Hi guys, so we're going to talk about muscles today, and we're going to explain how muscles work. Now, basically, when muscles perform a movement, and a movement we're talking about bones moving in relationship to where they're put together or their articulations. Muscles can only pull. They never push, ever. And essentially what one muscle group does, another one undoes. So as one pulls the body to move, there's going to be one generally somewhere else or on the opposite side that will pull it back. So when we're talking about muscles moving, the way that they're able to move bones is by being connected to them. And so they're connected to bones at places called origins and insertions. And an origin is basically located on one end of the muscle, and it's usually fastened to something that is relatively immovable or fixed. And that's going to be on one side of the joint. And an insertion is going to be connected. It's going to be on the other end of the muscle, and it's going to be connected to a movable part that's on the other side of the joint. And so if we look at this biceps brachii, you'll notice that the origins, everybody knows how to do a bicep curl. You're going to take this arm here and you're going to move it in this way. So essentially this angle that's right here will shorten. We'll go this way. So it's pulling, this right here is pulling this part of the muscle, or this part of the muscle connected to the bone. And so these guys that are up here, these are going to be, they're essentially the origins. And you can see at one side it's on the coracoid process. On the other side here, it's the supraglenoid tubercle of the scapula. And then down here, the part that's moving, this is the insertion. And that part right there is connected to the radial tuberosity of the radius. And so that's how we are allowed, by the connections on the bone, how the muscles can move the bones.
I have many students ask me, what is the difference between origin and insertion? And this is all about learning a new language. So when we think about the new language, we really have to understand what it's about. So let's step back and think origin and insertion is all about muscles. What's the purpose of a muscle? The purpose of a muscle is to move a joint. So when we look at a muscle, it has to cross over a joint, and it's going to attach to two different bones. Let's use brachialis as an example. Brachialis attaches on the distal 1/3 of the humerus, and it comes down onto the ulna. Its main job is for elbow flexion. So when we think about its movement, the humerus must be stable, and the movement is at the ulna. So on the ulnar aspect, that's where the insertion is, and the origin is going to be on the humerus. Origin is the stable part. Insertion is the attachment that has the moving bone.
So it does have an additional connection we're just not mentioning in the class that is on the ulna as well. And so the insertion is what? Let's answer this. Is it A, the end of the muscle that's stationary, B, the end of the muscle that is moving, C is a fixed point, D, none of the above, or E, both A and C? And hopefully you realize that the correct answer is B, that it is the moving part. Both A and C is talking essentially about the origin. And so when we're talking about movement, skeletal muscles most skeletal muscles functions in groups of coordinated movement. So there'll be more than one muscle that's sitting there allowing movement to happen. And there are very specific terms associated with this movement. And so you start with what's known as an agonist. And an agonist is a muscle that causes movement. That's a pretty generalized term. And so if we're talking about the abduction of the arm, Actually, let me do this. Sorry about that. You write this again. Agonist, muscle that causes movement. I'm going to do over here a little box, right? So if we're talking about the process of the abduction of the arm, then on here, an agonist for that can essentially be the deltoids. Now the next thing we're going to hit on is a synergist. And anything that says synergist or synergistic is talking about kind of this cooperative working. And so this is a muscle that will work with another muscle to perform the same movement. And so in here, the synergist example that I'm doing here is the supraspinatus. And this is a muscle that originates at the scapula and helps with this abduction of the arm. The next is what's known as a prime mover. You think prime as in maybe first or number one, right? And so this is specifically an agonist that does most of the work. Right? And this is, you need to have it, it's in a synergistic relationship. So this is really important to heed right here. And so in here, the prime mover in this example is the deltoids. And the last thing we have is what's known as an antagonist. And just like if you know anything about English, an antagonist is going to be, or using your root words, something that's opposite, right? So this is muscles working to oppose a movement. And so in this one, there are two that help to kind of do the opposite of this, right? The antagonist of abduction. So it would be the teres major and the latissimus dorsi. And if you know, they help with adduction. So this is one example. Now, let's do one more example. Actually, we're going to get out of this. And let's talk about a bicep curl, because these are ones that we like, and it's some of the easiest to look at, right? So in here, we have up here, let me make sure, nope, it is not wanting to. What we're going to do is we're going to look at flexion. And essentially we're going to decrease that angle that's right there. And so if we look at it, it's going to be this muscle that's up in the front, right? So the biceps brachii is going to contract for a bicep curl, right? So if we're talking about the flexion of the arm at the elbow, right? What are the agonists here? Well, agonist is going to be the biceps brachialis. There's something else that actually helps with that movement as well, which is the brachialis. So we have the biceps brachii, here, and then we have brachialis here. These are both agonists. They're both going to cause movement. In this case, flexion, right? Now, the synergist would be the brachialis here. So, because it helps the prime mover. The prime mover here is a biceps brachii. So we have, so far, we have the agonist. Within the agonist, we have the prime mover and the synergist, right? And the last thing we want to kind of talk about is the antagonist. And so if we want this to go back down, right, we need the back to start contracting. And so in that, this guy right here that is opposing the movement, right here, it's contracting. Here it relaxes to allow for that function of flexion. But when we want extension to happen, that's the triceps brachii that's going to cause that. So with that being said, that makes this the antagonist. Okay? And so that gives you two examples of those. And you can look through this to kind of get more of an idea if you want to think or kind of talk a little bit more about the different types of movers. Now, when we start talking about how basically muscles work, that movement can be basically analogous to what we know as different classifications of lever systems. And so when we're talking about levers, good idea. Let me get something up here really quick. Another one of these, right? We talk about levers in terms of what's known as a fulcrum, a lever, a load, and effort. And so a lever essentially is a rigid bar. In our case, it's going to be a bone. Okay? And this is going to move on a fixed point. That fixed point it's what's known as a fulcrum. And so if we do this, this guy right here is going to be our lever, and our fulcrum is going to be the bottom where we're going to look at the seesaw, right? That this rigid bar is attached to. Now, the effort is the force. Now, in our example, it's supplied by muscle contractions. And this is basically applied to the lever to move resistance. And just to let you know, the resistance is what we know as a load. So this would be to basically effort here. If we had somebody sit down on here, right, that essentially would be what's known as effort. Now, the load, as we said, is, let me move this a little bit better, right, is resistance. So in our example, when we're talking about movement, this is what's going to be the bone, the tissue, and any added weight. And this is what gets moved by effort. So this, if we have somebody else, maybe, or maybe you have, I want to draw a dog, but I can't draw a dog. I'm terrible. So maybe it's a little kid, right, over here. And you want this to go up, right? So you're going to put some effort down here. This is going to be, that's going to be him. This is going to be the resistance, right? That is placed against trying to move it by the effort. So in all of our examples on how joints are located, so basically these, you are always going to have, in every single example that we talk about, the lever right here is always going to remain the same. What's going to move is the fulcrum, the effort, and the load. And depending on, and these are, they move depending on essentially where, how can I say this? Where the joints are and what type or what part of the movie you're trying, or part of the body you're trying to move. So basic principle of levers. So when we're looking on here, just remember, right in the top here, right? So the load, right, is going to be what we're trying to move. The fulcrum is going to be basically what we consider the fixed point. Let's put this as our resistance, right? And then essentially, what else? And the effort is going to be our force that we're applying it to, right? And so if you have a lever, right, and you have a fixed point in the middle or wherever you have it, right, the fulcrum, it says effort further than load from fulcrum, right? So if the effort, say if the effort is over here, right, it's farther from this, and the load is over here, this is at a mechanical advantage. And you think if you put, like if you're trying to put something underneath something to lift it up, right, the further you get over here, the more force that you're going to have or power to be able to lift this up. Now, effort nearer than load to fulcrum, it operates at a disadvantage, right? So if you have this lever again, put it over here, but this time, right, your effort is closer than your load. This is what's going to be at a mechanical disadvantage. You're not going to get the amount of force here that you need to lift this. This is going to be too far past the center here for, you're going to end up having to create even more and more force for this. And so we're going to talk about the three classes of levers here, and it's dependent on relative position of both the effort, the fulcrum, and the load. And as you can see in these two top examples there, right, it's going to basically change how much movement that you can have, or the types of movement you'll see. So the first part here, this is a first class lever. And this is where the fulcrum, right here, right, is between the load and the effort. So it's right in the middle, right? And so you can see here, this is the perfect example of something that is given as a scissors. This is the point that's stationary, right? This is when you're going to bring in the handles to create effort to try to cut through whatever resistance that you have here, right? So you can think on here, the load is, again, resistance or the weight bearing, right? Force or the effort, otherwise known as a muscle contraction, right? And this, the fulcrum, is the joint. So on here you can see in this picture that this right here, you have the fulcrum right here, so that shoulder joint, right? And so you want your arms to go this way. And so the load is this ball coming down, and the effort is coming from your muscles towards the back to lift your arms up. Right? So this is a perfect example in the body that uses a first class lever system. Now in another example that they give in your book is your head as well. And so at on the base, right, where your spinal column is going to come up, and then you have the atlas that's basically allowing those condyles, occipital condyles to kind of lay on there. The fulcrum, or that fixed point, is in the middle, right? And you want to look up. And so the weight or the resistance, which is the load, right, is forcing down here. And so this muscle in the back, for you to lift your head up, this is going to have to contract. And that's where you're getting the effort in. And so this gives you a couple examples of first class lever systems. Second class lever system. You can see the fulcrum, right, or the fixed point is on one side of the lever. The resistance or load is in the middle, and the contraction or the force, right, and effort that you put it in is on the other side. So example of this that can give you a good idea of how it works is a wheelbarrow, right? And so the fixed point is over here where this wooden piece attached to the wheel. And then essentially what you want to do is you have your load or your weight here, and you want to lift this up on the end, so you're applying some pressure here, right? So this is where the resistance is between the fulcrum and the effort, right? And so you can see it also by standing on the tiptoes here, right? You can see that this fixed point or the fulcrum is right there on the toes. That's where the joint is, and you're going to go into that plantar's flexion. Now, the whole body weight is coming down right here, which is where the lever is, and the effort is coming over here because that's where your muscles are working, that gastrocnemius, right? And so this is a second class lever system. And it's going to show you in the picture next. It gives you kind of this close-up, right? And so the joints on the ball of the foot here is a fulcrum. The weight of the body is the load, and the effort is exerted by the calf muscle known as the gastrocnemius is one of them. So this is a second class lever. And if you think about this, this is, if you talked about earlier, when we're talking what's at a mechanical or mechanical advantage and disadvantage. This is where the effort is farther from the fulcrum, right? Than the load is. So this one is actually at a mechanical advantage. And let's discuss our last lever system, which is our third class. Now, just to let you know really quick, the second class that we talked about, it's pretty uncommon in the body. You don't see a lot of examples of that at all. Now, our third class lever system, this is essentially, you see that you have the fulcrum or the fixed point at one end. You have where the contraction happens at the, towards the middle, and then the load or the force that's coming down, the resistance, right, is on the other end. So a perfect example of this are forceps or tweezers, right? And then you can see that is a fixed point right here. And then this is going to be our resistance. We're going to try whatever's in there. We're going to try to hold it in and push pressure on that, right? And depending on how strong that is whether or not if it's going to have any give. So this is basically, the force or the resistance against it. And then this is where we're going to apply our pressure or our force into it. So essentially, an example of this third class lever is when you're talking about going and actually doing a bicep curl. And basically, if you look, let me get a different color here. If you look here, right, this is where you have that elbow joint between the humerus and the radius and ulnus. So this is where we have our, don't really like this, it's hard to see. Here. This is where we have our fulcrum, right? That's our fixed point. Now, we're trying to lift this weight. So that's the resistance we have, right? So if we look at that, that part is essentially the load. And if you remember, right, this over here is where the muscle is essentially connected, right? And it's going to move up this way. And so this is the area that has the effort because that's where it's attached to the bone. And so let's go and look at it right here in a better picture. So attached right here, right, the load or the resistance here that we're trying to move up, and then the effort here, right, because it's going to go across that joint and come over here. So if you remember from earlier when we were talking about it, so here you get the fulcrum, right, is here, and the effort is right here, and the load is here. So if you notice, the effort is nearer to the fulcrum. So in that case, this is at a mechanical disadvantage. So that kind of gets through the lever systems in our body and how they work. So let's go through here and figure out if you can identify what type of lever system these are. Is this a first class, second class, third class, or none of the above? Hopefully you figured out this is a first class, and can you label them? This is the load, right? This is the fulcrum, and this is the effort. Again, the load is the weight or the resistance, right? The force is essentially going to be the contraction that you have or the force applied so that we can move the load. And the fulcrum is the fixed point. If we're standing on our tiptoes, what kind of lever system is that? Hopefully you said second. If you said second, you would be right. And so let's go on to the next part of this. So there are more than 600 muscles in the body, and they can be grouped by function and location. Information for each muscle can be interpreted in part by the name of the muscle. There are 7 different criteria for naming muscles. And so the first is, where is it located? So sometimes the muscles are named by the body region or the bone that they're associated with. Sometimes they're named due to muscle shape. So deltoid, when you look at it, translates into triangle. And if you look at the deltoid, it's that shoulder muscle towards the top. It makes a big triangle shape on the shoulder. It can also be named due to muscle size. So maximus, like gluteus maximus, is going to be large, where minimus or gluteus minimus is smallest. If you're talking about longus, you're talking about something that's long. We can also name them based on the direction of muscle fibers or the fascicles. So when we're talking about rectus, as in rectus abdominis, we're talking about the fibers running straight. If we're talking about something being transverse, we essentially are talking about fibers that run at a right angle, or oblique, we're talking about them running at an angle to some imaginary defined axis. We can also name them based on the number of origins. So when we're talking about biceps brachii or triceps, we are talking about biceps being 2 origins or triceps being 3. Location of attachment is also important, and they're named according to the point of the origin and assertion. Origin names are put first. Muscle actions are also part of skeletal muscle naming, so they can be named for actions they produce, i.e. a flexor or extensor. And most of the time, or sometimes, not most of the time, but sometimes several criteria can be combined to create one name. So if we're talking about the extensor carpi radialis longus, when we're talking about the different parts, right? This part right here is going to be for the muscle action. This right here is talking about the location of the origin, and that's, of course, in the hand. Right? Radialis is talking about the insertion. And longus is talking about the size. Basically, it's long. So you at times can have names that have several different criteria put together in one name. So to learn the names of the muscles, you can basically focus on, I will ask you for some location, not a lot, but I would just focus on knowing the ones, just the ones that we talk about in lab, right? And so when you're studying for the lab practical, and you're studying this for the exam, essentially you're studying for the lab practical as well. Be aware of information learned from muscle names, read descriptions or identify on figures, relate locations and descriptions, relate attachments to actions, and act out movements on yourself, and those will all help you learn the names of the muscles. So muscles are only named by location they are in the body. Hopefully you said false. They have a list of 7 different criteria, and we've gone over those. And so let's point out some of the muscles that we've talked about when we were in class, right? And so if you look at the masseter muscle here, right, that helps to elevate the mandible. The trapezius is here on the side. The deltoid is that big square. In the front of the arm, and you can see the hands are coming out here towards the palms out, right? You have the biceps brachii, and towards the back, you have the triceps brachii. Here in the front, as part of the quadriceps, you have the rectus femoris, and you can see on the medial side, you have the vastus medialis, and on the inside, or the lateral side, you have the vastus lateralis. And for the lab, if you were to pull this out and you take off the rectus femoris, you would have the intermedialis in the middle. You can see here is the tibialis anterior. The gastrocnemius is the calf, and right below that, behind it, is the soleus. You can see this inner lane on the inside where the thigh is the gracialis. Inside to that is the adductor. The sartorius goes across the leg here. You have the external obliques, which are on the outside, on the sides of the body, and right underneath that is the internal obliques. And going up and down in the center is the rectus abdominis. You have this area right here is the pectoralis major. And on the side here on the neck is the sternocleidomastoid. If you look at the back, you can then again see the sternocleidomastoid. It's a little bit easier to see it when you look at it from the front. The trapezius is right here on the shoulder, or not the shoulder, on this neck part that comes down. Apologize for me. The triceps brachii is here in the back of the arm. The deltoid, you could see that on the corner here on the shoulder on both the front and the back. The lower back is the latissimus dorsi. You can see that. Now underneath, that helps to support the back, is the rector spinae group. The gluteus maximus is this big part, and right towards the top underneath is the gluteus medius. That's much smaller. You can see this, but I did it more in the front. Makes it easier is the adductor muscle here. And then for the hamstring group, you have the biceps femoris, that's here. Smaller on the other side is the semitendinosus, and then towards the middle, remember M for towards the medial side is the semimembranosus. The calf again is the gastrocnemius, and right underneath that, smally, is the soleus. So that's a quick review of what we went over basically in the lab. This is just showing in these groups of muscles after here, or just kind of showing you some up close to help you with this. So the masseter muscle is here. If you go into the next one, sternocleidomastoid. Here you can easily see the deltoids, the pectoralis major, the triceps brachii. Of course, there are different heads, but you do not need to know those. And the biceps brachii. You can even notice here's the brachialis. Remember when we talked about our example earlier with the synergist, if you were wondering where that was located. This gives you a nice look at the triceps brachii, also the latissimus dorsi. In here, we have the trapezius. Of course, you can see the deltoid really nicely there, and the latissimus dorsi again. You have the external obliques. Right under that, if you remove that, you'll notice the internal obliques. In front is the rectus abdominis. This is a nice close-up of the leg muscles. And so you can see that's going nice and across the front there, right, is the sartorius. And then you get into the quadriceps. So this bigger muscle here, again, is the rectus femoris. And then you can see towards the inside here, underneath it slightly, and it comes out, you can see the vastus medialis. And on the other side of it is the vastus lateralis. On the other side, you can also see the abductor muscle and the brachialis. The brachialis is the nice one that's all the way down. Then you go slightly inside, you can see the abductor. And this last part, we have the tibialis anterior. You can see right over here. And the soleus, you can kind of see this one. Normally you can see better in the back.
M-U-S-C-L-E. If you rap to the beat, learn these muscles with me. The 12 major muscle groups, that's what we're gonna learn. No time for fatigue, cause lactic acid burns. On the front of your arm, you'll find your biceps. On the back of your arm, you'll find your triceps. Biceps, let you flex your elbows and touch your nose. Tricep extends and let you touch your toes. The push-up, an exercise that's very low tech. Push away from the ground, now you're using your pecs. Flip it around when you find yourself laying on your back. The way to pull yourself up is to use your lats. The six-pack, rectus abdominis is part of your core. The low back, erector spinae, and a couple more. Like when you twist and turn, feel the burn in your obliques. Spend time on these and you'll have quite the physique. Shrug your shoulders and give a look that's curious. What caused them to shrug is known as the trapezius. Can't forget the shoulders, front, mid, and rear deltoids. They help you raise your arms. Please never do steroids. Yes, your muscles might get bigger, but there's no side effects which affect your health for the worse, making it complex. Strength training should be done all life long. Pardon this lecture and let's get back to the song. Check it, our lower half is something we must train, cause all of it's connected and linked like a chain. Quadriceps, 4 muscles on the front of your thigh. They help extend your knee and bring your foot to the sky. The flip side, find your hamstrings which help you strut. They also flex your knee and bring your heel to your butt. Gluteus maximus, large and one of a kind. It helps us stand and sit so that we can unwind. Gastrocnemius, the last muscle you should know. It extends our ankles so we can reach our tippy toes. Keep our muscles strong and at their peak. Need to work them out 2 to 3 times per week. How many reps? A common question of intrigue. A good rule of thumb is to work them to fatigue. Now you know major muscles like the back of your hand. I just hope this simple rap helps you understand.
Okay, that was just kind of silly in there to help you relax. Before we get done for this first part, so the last part here that we have, of course, is looking at the major injection sites in the muscle, right? And so injections are given deep in the muscle because of the following reasons. Injected substances can survive the oral route. There's less pain because there are less pain receptors in deep muscle, and absorption is faster than other routes. And so let's look on here and take a look at the different injection sites. Is that, yeah. So we have 4 major intramuscular injection sites. And so the first one that we're going to look at is the deltoid here. And you can see this injection site, they're showing you the location of it right there, that triangular site there on the shoulder. The next one we're going to look at is the ventrogluteal site. And you can see they're doing this hand shape in this V over there towards your basically hip, and kind of giving an idea where the anterior superior iliac spine is located, and roughly in that area is where they're going to do the injection. The next one we're going to look at is the vastus lateralis. So on here, you'll notice that the injection site is right over here in the lateral middle third of the thigh. And so it's basically between the greater trochanter and the knee. And the fourth and last site that we're going to look at is the dorsogluteal site. And basically, it's used above this imaginary line between what's known as the greater trochanter and the posterior superior iliac. So it's basically administered lateral and superior to this image. So this, in other words, is when you get a shot in the butt, right? This guy is when they give you shots in the leg. This guy is when they're giving you a shot in the hip. And this one is when they give you a shot in the arm, right? And you can look on here, the pediatrics, when they do injections here, they do, let me go, yeah, I do it for that. They do dorsal, or the deltoid muscle, right? They do the ventrogluteal site. They do the dorsogluteal site, right? But this one is not recommended for less than 3 years, right? And then they can also do the vastus lateralis. We'll do this. They can, on adults, do the deltoid and the ventrogluteal sites. Now, they'll do the dorsogluteal site in adults, but they don't like to do it if the adult is obese. And they will do it in the vastus lateral. And so those are the major injection sites. And so for the end of this, we're going to go over some muscle-related terms and what they mean. Black. So convulsions, these are uncontrolled muscle contractions and relaxations throughout the body that causes the body to shake. Fibrillation is irregular muscle contractions. They can be localized to either skeletal or cardiac muscle. Myalgia is a term that just means muscle pain. Muscular dystrophy is a degeneration of the skeletal muscle tissue. So the deterioration of skeletal muscle tissue. It is known to be caused by an inherited gene mutation, and it is an autoimmune disease. Sorry. Autoimmune condition. A lot of diseases in this group or this type have unknown causes. The myasthenia gravis is an autoimmune disease. And this is where the body attacks acetylcholine receptors. And so this will end up causing muscle weakness and fatigue. And myoma is tumor formation in the muscle. And so these are some of our muscle-related clinical terms. And for the next, that's it. When we get back, we will be starting on part 2 of this lecture.